Chuck with Mid-Georgia Ambulances here. We're kind of continuing along a theme that we've been working on. Last week we were talking to you about the #1 thing to do is call 911 if you're having a heart attack. This week we're going to tackle what happens when you come, because you guys come kind of storming in with all kinds of machinery and all kinds of things going on.
Yeah, we do. And mainly the reason that it's so important to call 911 instead of just hopping in the car, throwing mom in the car and running down to the hospital, because you know, we're more than just a ride to the hospital, and we kind of want to give people a glimpse of, you know, what we do and what we are capable of doing and why it's so much more important.
We have a little video to show you, kind of really putting you inside the ambulance when you get there, because I would imagine first the blood pressure.
Yeah, first thing we do is we check the vital signs, get you hooked up and get you on some oxygen, increase your oxygen levels in your blood. That's
going to be kind of scary when the oxygen goes on.
Yeah. And then we hook you up to our cardiac monitor. We do a full 12-lead EKG because we want to take a big picture of the heart and see, you know, what's going on with the heart. Is this cardiac-related chest pain? We give first-line medications and start an IV and go ahead and draw blood. We're going to need all of that. And then if we see something that is happening with that EKG, we have the capability to pick whatever hospital we're going to transport to, and we actually send that EKG, transmit it to the hospital before we even leave the scene. And there's a physician on the other end standing there looking at it and recognizing the same thing that we recognize.
So I would imagine that when a person starts going through that with the oxygen and clipping on the vital signs, that it's very stressful.
It can be.
But in the long run, it's for your own good.
You know, it can be, but you know, what you didn't see there and what you didn't hear there is our medics are, you know, they are trained, that they know, you know, this is a moment in time. This person is scared to death. So they talk to you. They're going to ask you some questions. You know, they try and keep things lighthearted as, you know, as much as they possibly can, and they will joke around with you a lot. But they try to put the patient at ease as much as they possibly can while they're doing all of these things to them. You know, we work fast because we want to get this hooked up and have this 12-lead EKG within 5 minutes from the time that we get you, because we want to recognize that heart attack so we can transmit it to the hospital and get them, you know, and get the ball rolling on that end. Something that people don't realize now is that we don't just go to the emergency room with a true heart attack. If we see it, we recognize it, we go straight to the cath lab with those patients now. We don't stop off in the emergency room anymore. We get immediate treatment. I mean, just as fast as we possibly can.
And this is the piece of machinery that will give the doctor the reading, the 12 gauge that you're talking about?
12-lead EKG, yep. This is our cardiac monitor, our basic cardiac monitor. It takes all of our vital signs, and our medics are trained in how to read a 12-lead EKG, recognize a heart attack when it's happening, and send that using this monitor. We can send that to the hospital and have a doctor on the other end waiting for us, seeing what's going on.
I saw that you put some aspirin in your hand, you know, 2, 4, or whatever, that kind of thing. I mean, I would imagine that's part of the
It is. It's part of the first line of medications that we give. Aspirin helps thin the blood and helps, you know, in that situation. Another medication that we give is nitroglycerin, you know, so, you know, we give those first line medications. Again, all of these things are things that you can't do in the car. You know, if you just throw mom in the car, then you're missing out on all of these initial things that are extremely important, because when you're talking about a heart attack, time is muscle, you know, and the longer you wait, the more damage gets done. All
right, Chuck, thanks for giving us that insight, and hopefully that'll make you feel a little bit more comfortable if you can feel any kind of comfort in that kind of a situation. We'll see you next week.
All right, sounds good.